Hi, James. It's really good to meet you. I know things have been difficult lately, and I want to thank you for coming in. This is a safe place where we can talk about what you've been experiencing and how we can support you moving forward. From what you and your parents shared, it sounds like there have been a lot of changes, like withdrawing from friends, missing class, losing your job, and struggling with personal hygiene. You've also mentioned hearing things that others don't and feeling like people are watching or talking about you. To better understand what's going on, I like to ask you a few questions. These help me understand your symptoms and how they're affecting your life. Have you been hearing voices or sounds that other people don't hear? This question helps us check for hallucinations, which are common in psychosis and may mean your brain is processing things differently. Do you feel like people are watching, following, or talking about you? This helps us assess for delusional thoughts, especially paranoia, which can feel very real and distressing. Have you had trouble thinking clearly or staying focused? This could mean disorganized thinking, which can affect how you express yourself and follow conversations. How have these changes affected your ability to go to school, work, or take care of yourself? This helps us understand how your symptoms are affecting your everyday life and responsibilities. And last question, when did all of this start? And has it been happening most days or off and on? This helps us understand the duration and consistency of symptoms, which is key to making the right diagnosis. We also use some tools to help support our evaluation. First off, we will use the PANS assessment tool, which is the Positive and Negative Syndrome Scale. It's a structured questionnaire that helps us measure both positive symptoms like hallucinations or paranoia and negative symptoms like social withdrawal or lack of motivation. It's useful for tracking symptom severity and your progress over time. We'll also do a urine drug screen. This helps rule out substances that can cause symptoms similar to psychosis. For example, marijuana, stimulants, or hallucinogens can lead to hallucinations or paranoia. If substances show up, we'll know to factor that in. If not, it helps confirm that we are dealing with a primary psychiatric issue. Based on what you've shared, your symptoms are most consistent with schizophrenia. You've been experiencing hallucinations, suspicious thoughts, withdrawal from daily life, and these symptoms have lasted more than a month, which meets diagnostic criteria. We've also considered other possibilities. The schizophreniform disorder, similar symptoms, but typically resolves in under 6 months. Major depression with psychosis, which includes sadness or hopelessness, which you haven't reported. Delusional disorder usually involves one strong belief without hallucinations or severe functional decline. Treatment plans. The first step is often a medication called an antipsychotic, which helps reduce voices, paranoid thoughts, and disorganized thinking. Two common options include risperidone, often effective within 1 to 2 weeks with full benefit in 4 to 6 weeks. Side effects might include sleepiness, mild weight gain, or muscle stiffness. In some cases, it may affect hormone levels, but we will monitor that closely. Another medication that is commonly used is Abilify or aripiprazole. It works similarly, but tends to have fewer side effects on weight or sleepiness. Some people feel a bit restless or have trouble sleeping at first, but that can usually be managed. We'll start low and slow, monitor how you're doing, and adjust as needed. Next, we will do cognitive behavioral therapy for psychosis. Alongside with medication, we will also recommend this. This type of therapy is designed specifically for people who hear voices or have unusual thoughts. It helps you learn how to cope with distressing thoughts or voices. It challenges beliefs that may be untrue or unhelpful. And it builds tools to manage daily stress and improve insight. The CBTP has been shown to reduce symptom severity, especially when used early, and improve how people feel about themselves and their experiences. Another thing we can use is coordinated specialty care. This is the best approach using team-based model called coordinated specialty care. This includes a therapist for emotional support and skills building, a case manager to help with things like transportation, housing, or insurance, a school or work specialist to help you get back into daily routines, and family education to help your loved ones understand what you've been going through and how to support you without adding pressure. CSE is the gold standard for early psychosis treatment and improves long-term outcomes, reduces relapse rates, and helps people stay in school, keep jobs, and feel more connected to their lives. Early onset versus adult onset schizophrenia. Let's take a moment to talk about how your experience compares to something called early onset schizophrenia. Your symptoms started at age 22, which is common for schizophrenia. For many people, symptoms begin in their late teens or early 20s. That's what we call adult onset. It's the most typical form and usually responds better to treatment when we catch it early. On the other hand, early onset schizophrenia happens when symptoms begin before age 18. This version is much rarer, and it often shows up during the teenage years or even earlier. When it starts that young, it can interfere with how a person grows, learns, and connects with others. Here are some of the main differences. Early onset usually starts during childhood or the teen years, while adult onset starts later, like in your early 20s. People with early onset often struggle earlier in life, like having more trouble in school, making friends, or learning how to express themselves. When schizophrenia starts younger, it can be more severe and harder to treat. The symptoms can be stronger, and it can take longer for medication or therapy to help. Adults who had a normal childhood and did well in school or work before symptoms began, like you did, often respond better to treatment and can get back to doing the things they enjoy with the right support. So even though what you're going through is serious, the fact that these symptoms started in adulthood and not earlier means there's a better chance of improving with the right care. That includes medication, therapy, and having a team that supports you. Please let me know if you have any questions. Thank you.